We begin tonight with COVID-19 and revelations that New Zealand's first infection was actually a week earlier than previously thought. The Ministry of Health originally recorded our first case of the virus as a returned traveller from Iran back on February 28th, but today it revealed the virus was actually in the community a week earlier on February 21st. The new index case has come about after a Waikato family was visited by a family member from Italy. The visitor was sick and 5 members of the household became ill shortly after. But none were tested because Italy wasn't a country of concern at the time. The case has only come to light after a male member of the household recently had a sore throat, got a COVID test and produced what's called a weak positive result, indicating an old infection. That means 6 old cases were added to New Zealand's COVID-19 tally, along with 3 new community cases from today. Those cases are all linked to a man who had left managed isolation in Christchurch after a flight from India via Fiji on August 26. That man flew to Auckland from Christchurch on September 11th and tested positive 5 days later, despite 2 previous negative tests on day 3 and day 12. Now, we wanted to talk with the Director General of Health, Ashley Bloomfield, about all of this tonight, but he declined to be interviewed. But joining us now is the Health Minister, Chris Hipkins. Good evening, Minister.
Good evening.
So the government has repeatedly told us that we went hard and we went early, but isn't it now apparent we actually didn't go early enough?
Oh, no, I don't think that's a fair conclusion to make. I think, we've always known that there were cases out there that went undetected in the early part of our dealing with the our response to COVID-19. That's not unusual. Other countries are in exactly the same position. People did what we asked them to do, which is that they stayed home, they got better, and they never got tested. And clearly.
But that's not quite how it worked, is it, Minister? Because they were symptomatic in Waikato and couldn't get tested in mid-February. They'd had a direct link to overseas travel, but kind of didn't marry up with the testing criteria at the time. So is that good enough?
Look, I think it's probably frustrating. I think at the time the testing criteria at that early phase could have been more liberal, and certainly much more liberal now, and has been for quite a long time. I think it probably could have been more liberal in the beginning.
So you should have gone wider with your testing regime from the start?
No, the testing regime was established based on the clinical guidance at the time. So it was medical professionals. They issued the guidance on who should and shouldn't be tested. And obviously, at the time, people coming from Italy, if there hadn't been, the big outbreak in Italy at that point, that there subsequently was. And so it wasn't included in the testing criteria.
This is a complicated web, so I want to break a few bits of it down, so do bear with me. So to be clear, the 6, which are old cases, 1 is a traveller who came from Italy and is infected. Did they go back to Italy?
Yes, my understanding is that they are back in Italy, yes.
Right, so the other 5 are people who live here permanently.
Yes, that's correct, yeah.
So how do we know for sure that that traveller who returned to Italy was actually infected with COVID-19?
My understanding is that serology testing has been done in Italy for that person who travelled to New Zealand, and that serology testing completed in Italy has been shared with New Zealand. My understanding is that serology testing was done in July, but the issue was that the sort of, if you like, the weak positive cases have caused all of these things to be linked up since then.
So if that testing was done in July, when did the man with the sore throat raise the alarm, in essence?
Well, it wouldn't necessarily raise the alarm because someone being tested in July and the serology testing, the people who did that in Italy would have identified that the infection had been in February, that it was a recovered infection. So there would be no need to trace recent contacts because they would be historic. So,
understand that, Minister, and I'm sorry to interrupt, but I'm just trying to make this as clear as possible. Did that person who went home to Italy and later had testing that suggested they had been infected not bother to contact the family that they visited here in New Zealand and inform them of the fact that they may have been infected at the time they were visiting?
Oh, look, I don't have the level of detail about the conversations that they may have had with the family. The one person from the family got a test last week, and that's what's alerted us now to these historic cases.
Okay, so the 5 people you are recording as probable cases, the ones that remain in New Zealand, how do you know that they are likely to have had it, and why not spread the net further? Why is there just 5 people in this group?
Well, my understanding is that they're regarded as probable cases because the interview process identified that they recorded symptoms at about the same time as the person who did have the positive test. Now, testing them won't necessarily tell us anything in those cases. Further testing is still taking place, but it may well be that they come back negative because it was such a long time ago. They're not necessarily going to show up a positive test. In fact, it's unlikely that they'd show up a positive test, and it wouldn't necessarily tell us much.
Understand that. So is it therefore likely that there are other probable cases that you're not recording? Because it has a ripple effect, doesn't it, if they've had contact with people?
Look, absolutely. All of the epidemiologists will tell you this, that during our lockdown, our level 4 and our level 3 lockdown, there were probably quite a significant number of cases of people who stayed home, they got better, and they never got tested. And that could be quite a significant number.
So what work's being done to see how far that infection went or got? Are you trying to track those numbers?
No, we wouldn't be able to do that now. That would be a relatively futile exercise because of the period of time. But if you look at the extensive community testing that we have done, I think we're getting up close to 1 million tests for COVID-19 that we've conducted in New Zealand. If there'd still been COVID out there, so if they'd passed that on to people and there was still a chain of transmission going on that we didn't know about, the extensive testing that we have done would have started to reveal that, and it hasn't.
Okay, so when you get cases like this with a weak positive, for everyone, are you then going back and doing what you've done with this family to identify probable cases and adding them on to our tally?
Yeah, so we go back in any positive case, whether it's a weak positive, a strong positive, we do an investigation, or the Ministry of Health do an investigation, working with public health units to identify as much information as possible that helps with piecing the jigsaw puzzle together. And so that'll include looking at whether serology testing is needed, so that's a blood test, to identify, whether it's a historic infection. They'll look at whether there are other people. They'll do an interview process, and that'll help to identify whether there are other people who were symptomatic at the same time. All of those things happen.
Okay, there's a bit more that I want to get through reasonably quickly. So there are 3 community cases linked to a man who flew from Delhi, right? How are they connected to him? Where did they pick it up?
So that's one of the things that's happening at the moment. We're going through to identify exactly what the connections are. So there are some points of connection. So we know through the genome sequencing that it's the same virus, if you like, that's infected these different people. We know that they were on similar flights, or they're on the same flight coming into New Zealand. They were also on the same transfer flight from Christchurch to Auckland after they had been in managed isolation in Christchurch.
So you haven't identified the flight yet that you think the infection occurred on?
No. So it's possible that it was the flight from Christchurch to Auckland, but that would beg the question of how someone positive, having gone through managed isolation and quarantine, came to be on that flight in the first place. So those are all of the things that are being identified now.
Are they strangers to him?
My understanding it's another family group, that they were sitting near to each other on the plane from Christchurch to Auckland, i.e. they were sort of in the same 2 or 3 rows of the plane. And so, my understanding is that they don't necessarily know each other,
right.
but I don't have all of the detailed information about the relationships between all of the different cases yet. I know that the most recent cases, the 3 cases today, they're all one family group.
Okay, so 2 or 3 rows away on the internal flight from Christchurch to Auckland. What about from Delhi? Where were they sitting in relation to him?
The public health unit have got that. I don't have that information. I don't have the detailed seat chart for that, but I know that the public health unit will have that information, and they will be going through and identifying, they'll be piecing all of it together, including looking at other people who've been through managed isolation and doing the genomic testing and sequencing for all of the other positive cases that might have come off that flight as well.
I suppose what I'm asking you is how confident you can be that they actually caught it from him and not someone else on that flight.
Well, look, I mean, that is, you have to remain, you've got to keep an open mind in these processes. Sometimes at the beginning, it rings a few alarm bells, and then the pieces of the puzzle slot into place and it becomes less of an issue. But you've got to keep an open mind in the early stages of an investigation. We just can't explain this one quite yet.
So, the flight crew who were on board the internal flight from Christchurch to Auckland, did they continue to fly after that?
I don't have that information, sorry.
Isn't that critical?
Look, it absolutely, and the Public Health Unit will have that information, but I don't have that to hand.
Is that all the more reason to tighten up some of the rules around aircrew?
Yeah, we've been working with the airlines on the aircrew regulations. Of course, domestic flights are treated differently to international flights. We do have a pretty rigorous regime around international flights. And there are also requirements around those who are doing those transfer flights as well.
But you are not reviewing it as a consequence of this infection that you're now investigating?
Oh, we review everything, all of the time.
Are you likely to make changes? Are you likely to make changes as a consequence?
Well, one of the things we have to bear in mind is that this was a transfer flight that was transferring people who had completed their isolation back to Auckland. So there shouldn't have been a risk on that flight.
But the point was, isn't it, that there was?
Well, that's right, but they could have easily not been on a chartered flight. They could have been on a regular domestic flight instead. So we're looking at all of those things. We always look at all of those things to make sure that the processes are as robust as possible. But the real question, and the thing we've got to get to the bottom of, and which we're working as quickly as we can to get to the bottom of, is where the point of infection was, how it was that somebody potentially came to leave managed isolation or quarantine, potentially still positive for COVID-19.
Has that group of infection passed the threshold to now be its own cluster?
I don't believe so.
It's pretty close, though, isn't it, Minister?
I don't know what the exact number is that they describe as a cluster, but it's still at this point it's still a small related group of it's still a small related group of cases.
How worried do we need to be then?
I don't think we need to be worried. It looks like everybody in this group at the moment has done exactly what we would ask them to do. They've all been very responsible citizens. They've sought testing. They've complied with the rules, and managed isolation records would suggest that. So I think they are working very hard to do the right thing and ensure that they're not passing it on to anyone else.
Appreciate your time this evening. That is the Health Minister, Chris Hipkins.